Welcome to this episode of the Akan Coco Report. Today we are happy to have Tracy Høeg on. Tracy Høeg is an MD PhD and somebody that we've come to become great friends with on Twitter. As most of the folks we follow on Twitter is, she has a number of searing insights into COVID and has been kind of on the leading edge of policy and recommendations and kind of insight into the data on COVID for some time now. So Tracy, welcome and thanks for coming on.
Oh, thank you so much, Anish and Rochelle. I really love your show. I'm so grateful to have found it. I really found it because of your episode with Jay Bhattacharya, and then I've been an avid listener ever since. So, I mean, you guys have very honest dialogue, great insight, and so I count on you guys. Thank you.
Thanks so much. See, we gave her that script, so thanks for that. Thanks for reading it so well. So Tracy, you have a very interesting history. You're a Wisconsin Danish-American double citizen. You got your you had a BA in French, Phi Beta Kappa from the University of Wisconsin. You were born in Wisconsin, got your MD from the Medical College of Wisconsin, and then you went off to Denmark. And in Denmark is where you, while you were working in the ophthalmology department, you got your PhD in epidemiology and public health while you were at the University of Copenhagen, right? And then after that, you did PM&R, physical medicine rehab at UC Davis. You were a chief resident, and then and now you're in private practice in Northern California. Is that correct?
Yeah, that's right. I'm in. It's in Grass Valley, actually, where I'm in private practice. Yeah, that's correct.
Wow, that is so fascinating. So from that, because just from your your imprint on Twitter, certainly, I just figured you were an academic, and I mean, you clearly have academic type credentials, but you're in private practice. I wonder, are you? So when did you get interested in COVID, and when did you start talking about COVID?
Yeah, I mean, great question. I have lots of answers and thoughts about that, but I started getting interested in COVID, I think when I guess from the very beginning, before we even really knew that it was here, and we were getting word of, young physicians dying. There was an ophthalmologist, that we had a report of dying who was 38 years old. Yeah. And I, what's happening in China, you never really know, like how much of it is truth, and it was hard to get a handle on the numbers. And so I started really investigating it from the beginning. And I was interested in like the theory of viral inoculum, and like maybe young people were dying if they were exposed to high inoculum, and then basically, from that point, I became really interested and actually started studying it from the standpoint of COVID in children, because I have children, and because I was very closely watching what was happening in Denmark and their policies towards opening schools, and how they were viewing the pandemic was so different than how we were viewing and treating the pandemic, especially when it came to children. And so I really started looking into sort of what data we had on children, how much they spread COVID, how risky it is for children, how safe it is to open schools. And it was kind of like just, out of my own interest. And then it came to be out of concern for just children in the United States in general.
What were they doing? This was in the spring of 2020.
So this was in the spring of 2020. And I probably need to back up a little bit and say, so I had lived in Denmark for 7 years. And when COVID started, we had been in the United States for about 5 years. But still in our house, like we still spoke Danish, we still watched Danish TV. We kind of like live in this little like pretend world that we're still in Denmark inside of our house. And like, so like the worlds were not matching up in terms of like what was happening to children in the United States, especially I would say like children in public schools, and then the children in Denmark. And I just found it really kind of sad the way it seemed like, it was like 2 weeks to flatten the curve suddenly became like the kids are never going back to school, just like David Zweig said on your show. And that was profoundly disturbing to me, because I thought, well, in the United States, there really are not these places, you know, social services places for kids who are from poor families and underprivileged children to go during the day. And as a PM&R doctor, you know, I see kids with special needs and they're not getting their therapies. And so, I mean, that's kind of the place where I started to become interested in researching COVID and started writing about, you know, the discrepancies between the countries, and got connected with Amy Falk and the group of researchers in Wisconsin. And we did the Wood County, Wisconsin study looking at the spread of COVID-19 in public schools in Wood County, Wisconsin, which is a rural county in the middle of Wisconsin. And then so we finally published that study in MMWR in January of last year, and we had found that, you know, the rates of COVID were 36% lower in the schools than in the community, and that of the 191 cases that came into the school, only 7 were transmitted further within the school. And so, and really this was with, you know, it was with masking, as we state in the paper, but, you know, it wasn't possible to always have 6 feet of distancing. The kids ate unmasked indoors, you know, no masks during recess. It was like, there weren't really extremely strict rules, and things actually went really well. And this was pre-vaccine. And so, you know, I felt like this was an extremely important finding and study, and, you know, I was thrilled to have it published in MMWR. And then I was really disturbed by the reaction to it, eventually by the CDC, which was sort of like to require even more distance between students and make it more difficult to open up schools. And that there continued to be school closures, you know, all across the United States, sort of based on party lines and, you know, whether or not it was a red or blue state. And not based on science. And, you know, our group wasn't the only one who had found something like that. The Duke group from North Carolina had very similar findings to ours. And they started this ABC collaborative to sort of like help guide the CDC, and they were kind of similarly being ignored. And I guess I came on Twitter really around that time because, you know, that's when I started to realize something is not right. Like, why are we doing this to children? Like, why are we not, you know, making it easy for kids to go back to school? This should be a no-brainer, that kids have so much to lose from, you know, not being allowed to have in-person schooling. And so I really, that was my start, how I became, you know, motivated to start speaking up. And I've become involved in a bunch of different studies related to COVID and children since that time.
So it's so interesting that like your biases are kind of set up based on the fact that you have this kind of Danish background, and the fact that you were in this Danish bubble in terms of what Denmark was doing. Can you tell me how it is the Scandinavian countries? Was there a big difference in terms of, do you know if the Scandinavian countries were doing very different things? We always hear about Sweden, of course, right. But, you know, Sweden, Norway, I mean, were they all doing very different things when it comes to the schools, or were they all very similar when it comes to the schools?
So at the very beginning, they were really different. So Sweden basically said, you know, we're not shutting schools down. We're keeping all schools open. We're not shutting them down for any period of time. They did paid sick leave. They limited large gatherings. But they took a really different course, at least in the very beginning, from Denmark and Norway, which basically did the same thing, which was, so Denmark closed schools for 6 weeks, and then they opened the primary schools after 6 weeks. Those were the first schools to open. And I will tell you that, like, they opened up Tivoli Gardens, the oldest, you know, theme park in the world, and they made that a large outdoor school, just to kind of see how it would go. And then they started to transition into like Cub Scout, Girl Scout huts and things like that. And then they basically like started to have regular classes. And all this time, like maybe it was seasonality, but the COVID numbers were going down in the country. And then they opened up the secondary schools. They opened up the rest of the economy for the adults. So Norway had very similar strategy to Denmark. but they opened up just like 2 weeks later, the primary schools. But that's a very Scandinavian, I guess, concept. I would just say that like the children always come first. And as someone who started out here in the United States, and then so I ended up leaving my first residency in ophthalmology and moving to Denmark because, well, I could, and because they offer maternity leave, and they prioritize like children, time with family. So so in my mind, it's a very obvious divide, between the cultures of Scandinavia and the United States.
That's so interesting. And so, but just to be clear, Denmark and the Scandinavian countries, Norway, Sweden, they may have had 2 weeks here and there in terms of how long they close school for, but they have had schools that have been open since 2020.
So Sweden kept schools open without any break. And then, so what Denmark, and I cannot comment as much on Norway. I think that they were very similar to what Denmark did, but they had very brief periods of time where they closed schools again. But I will just kind of explain further that when they did that, when they always had a place for children to go for parents who are essential workers. So they had these brief closures, but then it would always be the same pattern of like, first the younger kids go back and then the older kids go back. Whereas Sweden really kept everything open equal, for everyone the whole time. Right. But Sweden also had a lot of excess deaths compared to Norway and Denmark in the very beginning, and which they attribute to the nursing home deaths. Right.
So I was just going to say, are most of the children in Norway, Sweden, and Denmark, not alive now because they kept schools open, or like what happened? Is it this mass death? Are the countries still okay, or are they?
They made a big deal about it like a month ago that there have been 3 child fatalities in Denmark during the pandemic. Wow. And so I understand that the first 2 children had basically like life-limiting illnesses, and then the third one there was a lot of like investigation into, because apparently this was a child that didn't have a known medical condition. But Denmark is 5.8 million people, so it's the size of Wisconsin.
Right. No, but still, the 3 deaths, 2 of them severe conditions, basically one healthy child in all of Denmark.
And they have a much lower seroprevalence rate, I understand, than we do. So the latest that I saw from like this summer was like 8%. And I don't know if you guys have seen the United States, but it's like between like 50 and 80%, depending on where you are. So it's not like keeping half of our schools closed really decrease the spread.
Yeah, isn't that so interesting? It's like Americans. Well, 2 points. One is that Americans are so insular that like we, for some reason, completely ignore the fact that there's Europe and there's so many different things that are happening there, and yet you don't have these mass casualty things going on in these places. Denmark, which is the size of Philadelphia, greater Philadelphia, about 5 million, has 1 healthy child that has had an issue, that has had a problem. And in Philadelphia, has kept schools closed or virtual or whatnot. I hear that. I was just told, in my small little business that I have 4 or 5 employees. And one of my employees just told me that, I'm not going to be able to come to work, the first week of January, because she just got a message from the Philadelphia school district saying that all schools are virtual that first week of the pandemic. So the first week of the new year. So, and it's fascinating, and you touched on this when you were talking. There's a second point. You touched on this when you were talking about how you had this nice data set from Wisconsin about schools being open, and you published it in the MMWR, the CDC's MMWR. And so what is it, what do you think is going on that folks are ignoring? Not just what's happening, across the pond in Europe and in certain countries there, but also ignoring, data sets from here. Emily Oster, has done a lot of work on this as well. And, she's also pointed out over and over and over again that, there's no point looking at like some worst case summer camp scenario. you should try to look at the entirety of the of the experience that we have in daycares and summer camps and whatnot. And overall, it seems to be a more benign picture than what public health officials who are mandating closures kind of recommend. Do you really feel that these closures are driven by an ethos that does not put children first in the United States? Like those people that are making decisions are making them knowing that children are going to suffer?
No, I don't think that. I happen to be of the camp that I actually think most people are good people and want, good things for children. But I guess, there are a few reasons I think for what happened in the United States. And in terms of looking at other countries for evidence, the United States does not have a history of doing that. I mean, the United States.
America first.
Yeah. I mean, I just want to, I want to say that, so I moved to France when I was 18, right? And then I ended up working as a teacher there of physically handicapped children, actually after I graduated from college. And I remember the parents telling me, like, I would never send my children to the United States because they don't take care of vulnerable, handicapped children. And, I mean, those are things that Americans need to hear. And I was glad that I heard that. And I think that, I think America always thinking that, they're the best and have all the answers is not, it's not healthy. It's not good for the United States. So there's that. And then there's also this problem with the CDC basically being a political agency. And I mean, I think we've kind of seen that over and over again. I was kind of like making a list the other day of all the messages that the CDC has sent out that seemed like more, political than science-based. And it's like masks reduce infection by 80% and like, covering, I guess like minimizing, vaccine related myocarditis and, there's a whole list, but like, but the point is that I think like teachers unions played a large role in the decisions and the CDC and what they were saying that could and couldn't happen in schools. And that there wasn't as much involvement from like different, scientists and physicians and public health officials and children.
There are a lot of scientists that disagree with the idea that schools shouldn't be closed, right? I mean, yeah. Where do you think they're? I mean, is it really a debate about science, do you think, or is it meaning? I think one of the things I see from the other side when I attempted to argue, I mean, I think I gave up on arguing with them a while ago, because I think anytime we get into these discussions, for some reason, everyone imputes bad faith. And but one of the things that came across from the other side was that, you keep saying that the risk to children is low. And if you keep saying the risk to children is low, you don't care about those few number of children that are going to have a bad event. So to them, everyone will agree that the absolute risk to children is low. But then once you say that, then they'll say, well, even a low risk, only zero risk is the best strategy in this particular case.
So yeah, I mean that's obviously true, like that some children are much higher risk than other children, and I think that's a point that needs to be clear, and I agree with that. But I think that the major point that a lot of people don't discuss is looking at the trade-offs of the school closures, right. So right. With the harms, I feel like that's been kind of like the problem all along, is the myopic focus on just COVID and not
right.
suicide rates and the decreased learning and the decreased socialization and kids not getting school meals and kids abuse not being reported and neglect and so there's a reason that we haven't closed schools before for like influenza or, and any other respiratory diseases.
You pointed out that the teachers unions. Do you think the teachers unions are the fundamental reason why the United States is different from say, Norway?
Oh gosh. Okay. So, I mean, that's a big question. So I guess I would say it's not just the teachers unions. I guess I would say like the number and diversity of people who were at the table in those discussions was not as great as in, Europe and Scandinavian countries where you're really getting together lots of different people to make decisions and like,
but Tracy, but isn't the CDC, like, why is it that the CDC why is the CDC not saying schools are a safe place for children to be? What is the reason for that?
Well, it's interesting.
If it's not teachers, if it's not them bending to the political pressure of, I assume, the teachers unions, because I don't know who else is on the side of keep schools closed indefinitely until there's some magical safety thing.
I wish someone could also give me that answer, because right after our study and the North Carolina study came out, Tony Fauci got on TV, Sanjay Gupta got on TV and said, it makes this seem like schools are safe. These two studies, we need to open up the schools. And then it looked so promising for schools opening. And then it was like, I don't know, something happened. And Rochelle Walensky kind of like got up and gave this press briefing about, what the plan was for reopening schools. And it was stricter than it had ever been before in terms of the amount of distance required between students. And, this was at a time when the prevalence of COVID was falling. And vaccines were coming, and it was like, why it did not make any sense.
So I mean, was it Rochelle Walensky or was it
well, I'm not saying her name to like put a blame on anyone. I don't have an inside track there,
what I meant is that in those days it was what's his name, Redfield.
Mm-hmm.
Robert Redfield, right? I mean, she was not yet on board, I don't think, but
so this is I'm talking about in March, actually, when all the rules changed. And and so it was a little bit different time, because and that may have been why it initially looked so positive, but I mean, the New York Post did like basically an expose article where they talked about like the teachers unions potentially changing the wording of the CDC guidance, and nothing ever really became of that. And I remember talking about it with Monica Gandhi. She's one of my best friends. We kind of like discuss everything, and we were both like, wow, this is going to be a huge story. And the New York Times and Washington Post, and they just ignored it. And I don't really have all the answers of why schools seem to unnecessarily stay closed here, but to me it always felt like a political thing. And I would say that a lot of it came from a place of Americans, being afraid, and it also a different. I mean, and I'm not saying I would never want to minimize COVID, and COVID is a terrible disease, and my husband works with immunocompromised patients, and I fully recognize that this has been a devastating pandemic, but we've certainly, I mean, it's been painted very differently in the United States by the media than it has been, in European countries. I guess I would just say that, especially the discrepancy is large, when looking at children and how dangerous COVID is to children. And, in my mind, I thought, so we're really, trying to keep levels of disease down, to protect the adults, right, with the schools. And that always made sense to me. And then when adults were available, or vaccines were available to all adults, I didn't understand why things did not radically change, like schools just go back to normal and no masks and, all this stuff that we were doing because we just had to throw everything at it to protect the adults. Why didn't schools go back to normal at that time? I don't understand that.
It is inexplicable. Rochelle Walensky was just asked a week ago to this day about, will you follow the science and stop relying on faulty studies and end mask mandates for children in schools? And she just responded with, the party line, which is children should be masked and children should be vaccinated. And I mean, it really, I mean, I don't know, you've gone and testified in Congress, right, about this as an expert, because you've done so much work and published all these studies and stuff. Do you get a sense when you go up there? Do you talk to Congress people? Do you get a sense of who is in the ear of these folks that are that this is, I mean, what do you get a sense of what's happening or why this is happening?
I mean, I think like the AAP and the teachers unions are playing a big role in what's happening. And again, I don't think that people are acting in bad conscience. I feel like people are, really doing what they believe to be, the right thing. So, but yeah, I mean, the testifying before Congress has become a lot easier because now you just do it over Zoom. Not that I had extensive experience with it before, but so I didn't actually get to meet people in person, but yeah.
So tell me, you've been obviously very outspoken about schools being open, and to your credit, that's a very courageous position to take for much of the last year. And I think history will shine a bright light on the fact that you actually did that. But you endured a fair amount of criticism from a number of folks, right? When did you start attracting when did you start attracting kind of negative attention, if you will?
Oh gosh. I mean, when did that start? Man, I'm so good at muting people. Sometimes people tell me and I don't know like that I'm actually attracting
Tracy, who is funding you to do this?
Oh yes, I did read
Is it the Koch brothers? Is the Koch brothers? Are you a Republican operative?
No.
Do I see a Donald Trump MAGA hat there? Is that what that is?
No, I mean, I am doing it because I believe that, children need an advocate. And I believe that that's, our role as physicians, I think, is to stand up, when we see sort of like injustices and see things, this does not seem right, kids should not be suffering to this extent, needlessly, that, we should stand up against it. But I think, it's interesting because I eventually had to leave Facebook because it was much more volatile than Twitter was.
Why? What were they saying to you?
So like, I guess what really happened was writing an article in the Washington Post in May, which talked about kind of what we've been discussing, that now that adults have vaccines, that school should be back to normal again. And, it was the Physicians Moms group that really kind of like made it clear that I was, they thought I was trying to kill children. And so then, I started realizing that they were finding out who I was on my personal profile. And so then I just left because I got too afraid of like being, I guess, personally attacked. And I mean, I know there are other ways that people can find me, but I had a lot of followers on there, and suddenly I was like, wow, like they're just reading all these things that other doctors are saying about me, and it got really hard. So, but then I got censored off of Facebook, and so then it what did you get? It was just for citing hospitalization rates, pediatric hospitalization rates, and I just used CDC's data and was basically talking about how hospitalization rates were falling and, like adult vaccinations, but then, that got censored, and then that was the end of that. So, but Twitter has been, I think, much better. I mean, I got censored on Twitter too. I don't know if you guys know, but I was talking about vaccination in children. And I said, that given the myocarditis signal, this was back in June, that it's not going, we're on shaky ground if we say for certain that the vaccine is good, or that the disease is more harmful than the vaccine, is basically what I said, because overall, and I said in healthy kids, and then that got censored and taken off, and so yeah. But I mean, I think a lot of people are being, and that was on Tucker Carlson, he eventually put it on the show, and I couldn't believe it. So like, because I didn't even know what Tucker Carlson was. And the producer called me like while I was working with a medical student and was like, hey, can we use your tweet on Tucker Carlson? And I'm like, who's Tucker Carlson? Anyway, so it ended up on the show because I didn't know who he was, but now I know.
Oh,
I
that's
don't
so
mean
funny.
to give away my ignorance, but
No. It's not. So it's interesting how you become this. How they've, how how people get painted. Like
yeah,
you get painted as these. It's a sign of the polarization of the times. What are your now? So you also, as mild mannered as you seem, you start up quite the controversy with a paper on myocarditis.
Yes, I know. It was, man, it's so interesting when you think that a paper is going to be so helpful. And then there's the reaction that we had. I mean, I guess I knew on some level that it was going to be controversial, but I really didn't expect the reaction we had. I mean, I guess I'll tell you that, we submitted it to the New England Journal and they fully reviewed it, and we actually got, positive feedback, and they gave us like things to change. And then we ended up deciding to upload it as a preprint, and we had consulted many people to help us write it, because we knew this it's a very, very important topic, and you don't want to get it wrong. Vaccine associated myocarditis, just so everyone knows what we're talking about.
Yeah, can you describe a little bit? Can you describe or give a short synopsis? Yeah.
So Ali Krug, Josh Stevenson, and John Mandrola and we basically started looking through the VAERS database for cases of myocarditis in children associated with the vaccine. So the VAERS database is like a reporting system for adverse events related to vaccination. So there was this known signal already from Israel about the vaccines, the mRNA vaccines causing myocarditis predominantly in boys. And so, we wanted to look specifically at children to see 12 through 17, to see how often this was happening. And the CDC had also come out with a report of it. Like, I don't know if you guys remember, it kind of was supposed to come out and then it was delayed. And then the amount that they reported ended up being really low, lower than they had reported in Israel. And so basically what we did was we started looking at cases where, the complaints were chest pain and then they had elevated troponins, and cases that, so John would, is a cardiologist who you guys know, are friends with him and you've had on the show. And he adjudicated all the cases. And we kind of like made an estimate based on the number of cases that had been reported of post-vaccination myocarditis, using the same criteria that the CDC had for diagnosis, and except we did not require, the main symptom criteria to be myocarditis. We said it could be chest pain with elevated troponin or EKG changes and or echo consistent with it. And so then we ended up finding this rate of myocarditis in boys that was about 10 times that of girls. It was predominantly after dose 2 of the vaccine. It was higher, so 1 out of about 6,800 doses in boys 12 through 15, and then it was about 1 in 10,000 in boys 16 and 17. And so actually when we released the preprint, our estimate was lower than the Optum database that the FDA had been using. And so they had reported 1 in 5,000. And so we thought, okay, well, we have some data here on it happens median of 2 days afterwards. And we have some more, stratified data than they have. And this is probably going to be helpful for people to see these numbers. And, the other thing that we did in our analysis was we compared it to the risk of hospitalization. And so basically what we found was when you look over a 120-day period at a given child's risk of hospitalization from COVID-19, that if you look at children who don't have medical comorbidities, they're more likely to get post-vaccination myocarditis than they are to be admitted with COVID-19 over a 120-day period, even at high levels of circulating disease. And so that ended up being like probably the most controversial part of it. So there were two parts, just the rate of myocarditis that we identified, and then that we stratified by presence or absence of comorbidity. So I'll say that since we released the study, there have been multiple estimates now from Israel and from Canada, and most recently from Hong Kong, that they exceeded the rates that we found of post-vaccination myocarditis. So that part of our study should no longer be controversial. And then you guys probably also know that there was this German seroprevalence study that was released that basically looked at risk of hospitalization and death from COVID-19 in children, and they also stratified it on by presence or absence of comorbidities. And so they found for a child without comorbidities to be admitted to the hospital and require treatment for COVID-19, that the risk was about 1 in 2,700. And the risk of, so I want to get this right. So the risk of, according to the Hong Kong study, the risk of post-vaccination myocarditis was 1 in 2,400. I hope I didn't get those mixed up.
No, you're correct.
And so, so they kind of verified, the findings that we had found, and we had only looked at hospitalization risk over 120 days.
Right.
So.
No, I mean,
and what time period were you looking at when you examined the database?
Yeah, so we were looking actually at the late spring, and so it was like May. Okay, so yeah, we were looking at May and June. And so that was, right when the vaccines started to be rolled out among children. And that was right during the Delta surge as well.
So I know you got a tremendous amount of blowback. I mean, my goodness, people were calling for all kinds of things. Really, I thought it was quite despicable stuff, honestly. And it's just because anything that is viewed as minimizing COVID, or anything that's viewed as that's viewed as even in the slightest taint of vaccines is seen as not on the team, and you shouldn't be doing it, it's irresponsible, and etc. So really bad stuff. But interestingly, you really moved the needle. I mean, I actually didn't know about the Tucker Carlson tweet. My goodness, forget about Wisconsin, Denmark MD PhD and all this stuff. I mean, what Tucker Carlson, what you have, the pinnacle that you've reached is Tucker Carlson and Joe Rogan. My
That's
goodness, right?
Been on Joe Rogan twice now. It's been mentioned there, I guess.
I know. So it is, your paper, that preprint is burned into, the memory banks of Joe Rogan. So Joe Rogan, believes, and he stumped Sanjay Gupta with that, right? Because Sanjay Gupta clearly was not plugged in and wasn't prepared for that. Joe Rogan was like, hey, look, there's this preprint that says that.
And Joe Rogan said it right. He even brought up the study, and he said, and they looked over the 120-day period risk of hospitalization. I was like, phew. So he said it. He said it right. I mean, Peter McCullough said overall hospitalization risk. So that's not what we looked at. But I mean, there needs to be a better conversation about vaccinating kids. People need to remember that there are individual risk factors for different children, right? And so lumping all children together for a disease that is overall low risk to them, and for vaccines that we certainly cannot definitively say reduce transmission. It's they reduce transmission for a short period of time is what we're seeing now, right? So that argument of we need to vaccinate, for the greater good is harder to make now, given that transmission detail. And then when you look at, so when we divide up children, I think we need to look at, one, have they been infected or not? And that's one thing that like we in the United States are not doing that. And I mean, that calculation needs to be done, because if you look at like data from the New England Journal on protection from previous infection, it looked like 90% reduction. You look at the Israeli study that they found that 6.7, and that was for hospitalization, and 6.7-fold reduction compared to double vax of risk of hospitalization. Like suddenly you take a child who's already been infected, and what is their risk of hospitalization? And I feel like no one is discussing that. And like I was discussing before, if you look at seroprevalence rates in the United States, some states like Arizona are over 80%. Right. And then, you look at that German study and you see that 0 of 7 million children over the age of 5 died from COVID-19. And you're like, okay, so if we're vaccinating children, for their own good, we better make sure that this vaccine is very, very safe. And like, there are also children who are at much higher risk, where we need to say, you need to vaccinate your child. Like it's in their best interest, because, they're at high risk of complications or bad COVID course. And, there needs to be a different discussion for girls and boys, I think, based on the data we have, yeah. But all nuance has been lost.
Yeah, no, it's really, no, this is all great points. And, obviously you're preaching to the choir. We're totally on board with this idea that like, it's not a binary thing. Like vaccines can be good, and then you can have like a real conversation about, certain demographics where the risk of vaccines may not outweigh the benefits of vaccines, and that's not some heretical thing that one says. I mean, and it also the history of that's also the history of vaccines. I mean, the rotavirus vaccine, after it was rolled out, was found to have more intestinal obstructions in young children, and they had to be modified. The dengue vaccine, vaccine was rolled out, 800,000 Philippine children, and was then found, that there was antibody dependent enhancement, and it's only recommended now. And so that was only after it was rolled out, and certain children, after getting the vaccine and then interacting with dengue, then got even more ill and died. So I mean, this idea of having some epistemic humility about what we don't know is really important. And I'm still befuddled completely as to why it is we are not doing that, or that conversation isn't happening in the right places. Now again, so you are kind of one of the leaders of this kind of guerrilla resistance movement, right? Where you are sitting there like tapping it out and uploading things to preprints, which then go on to Joe Rogan, and then Joe Rogan gets it out. So and you really, Tracy, I think you really massive credit to you, as opposed to just podcasting away from a basement cellar. You have
oh no, what are you guys doing there?
No, you have
what I'm doing.
No, not at all. You have actually shifted the conversation, and you've demonstrated how to do that, despite the fact that the establishment is so socked in on one message, and the establishment controls all the regular legacy media levers, right? Everything that Rochelle Walensky said. Rochelle Walensky says that masks reduce, children should be masked. ABC, CBS, NBC, not Fox, ABC, CBS, NBC, right. And MSNBC, all of them will say, the science says this is what's happening, right? And then you have this plucky band of intrepid scientists and epidemiologists and whatnot, who are kind of, generating your own data, and again, and so kudos to you in terms of doing that. And you've really, really, shifted the needle, and you've gone beyond just like, well, there's some random guy in his underwear on a YouTube channel. Vinay does wear pants, I think, but
okay. I was wondering.
Vinay, but you've shifted beyond that, so you've really pushed beyond that. So really, really great. What do you feel that the tide is turning, Tracy?
Oh my gosh! Every time I think it is, I just stop myself and I say, it's never turned before, so why would it turn now? So I mean, at some point it has to get so too ridiculous. Yeah. I mean, actually, it's so interesting. I think Leanna Wen coming out and saying that cloth masks are no more than facial decorations. I mean, that's going to go down in history as a turning point, because I mean, she's one of the people that she's that I guess. Who will we say? People who believe in cloth masks listen to, right? And who trust. And I think that I think that the tide is going to have to turn, also because it's like, at some point, parents are going to say, listen, I don't ever wear a mask. Why are my kids wearing a mask? Like, there's just going to be too many angry parents, and the parents that aren't angry don't know what it's like to wear a mask all day. I mean, you guys probably know, since you see patients, and I knew too. I was like wearing an N95 and goggles, and like, oh my gosh, I was like going nuts with like, I didn't want to infect anyone. And, I was less worried about my own, infection, but like wearing a mask all day is not easy. And yeah, I mean, I think, I don't know, is it a turning point? I sure hope so. I mean, I want to say something else, which is like, philosophically, I mean, the way that we've been looking at this is just, masking children has not been medically ethical when one thinks about like non-maleficence, and like how, we really don't have data to be doing what we're doing, and we just keep doing it. And, people who say that there are no harms to these kids who are deaf and who have autism and who have breathing problems. And, I mean, I don't know, it just makes me so angry, because, I know that people are saying that children need to wear masks because they believe it to be the right thing. But people who have kids who are suffering wearing masks are not being given a voice in this. And the children are certainly not being given a voice.
Right.
So I think it's unethical what's happening.
Yeah, no, thank you for speaking up, and thank you for speaking up as early as you did. So if another virus lands on the shores, what would you do? What would you say are the biggest mistakes that we made, and what would you do different? So I'm going to rewind to March of 2020. Now, I wrote a letter because I was scared. I don't know what the heck COVID was. I thought, who knows? I saw all this stuff in Italy, and yeah, I was really worried. I had no idea. My child, I have one of my eldest daughter is is on immunosuppressants, and yeah, so I put her in a room for 2 weeks while we tried to sort out the situation, and I wrote a letter to the school saying, I think it makes sense for you to stop this, to close the schools. I didn't say to close the schools for 18 months, but rewinding, what would you do in, say, so March of 2020, maybe we didn't know enough about the virus, right? But say April of 2020, now we had a lot more experience from New York and stuff, and you didn't have children's hospitals filling up in New York, but and beyond. So what would you do? What were the 5 things, say, that you would do different?
So, I mean, first of all, I would say we need to have better communication between countries in terms of like, the data that we're seeing and the strategies that different countries are taking, and what is and what isn't working. I felt like that was really hodgepodge, and we've discussed about before how that affected the school reopening thing. And then I would say that, so the CDC needs to have a better way of collecting data and making it transparent and making it easy to understand. I mean, I still cannot believe that to this day, when I am looking for information about COVID-19 and the vaccines and previous infection, that I'm going to the Danish website and I'm getting much better information, than what I'm getting from the CDC, and I trust it more. And I think that's the other thing, is like, our public health agency needs to be an agency that we can trust. Like, I think that they need to be able to say when, they don't know for sure. Like, I think that all of the, flip-flopping on this works, no, it doesn't, yes, it does. Like, I think that there needs to be more, transparency about, not, and humility about what we do and don't know. So also, I think that, I mean, people who are marginalized in our society. So I'm thinking, poor children, who don't normally have a voice, need to have some sort of representative, or some sort of like, way of being spoken for in these debates, because otherwise it seems like they're being forgotten, like their needs are being forgotten. And then let's see, there was one more thing that I thought of, and now, hold on. Let me come back to that.
It all sounds very reasonable, Tracy. It's utterly, I mean, absolutely reasonable. But I'm afraid that it's not, it's not a matter of reason and being reasonable. Because if it were, the tide would have. You talk about the tide turning or things shifting. I'm concerned. I'm not. Well, it's a double-edged sword. But now it's very possible that things will recede very quickly. That the policies will change with the Omicron. Perhaps, right? I mean, let's imagine that all of a sudden it becomes much milder than it had been.
Right.
That we have these big waves and very few hospitalizations. Then the same people who've been making all these bad decisions for the last 2 years will all of a sudden say, okay, now it's okay to open schools. It's okay to, they will drop some of the policies, but no lessons will have been learned.
Right.
So that the next time there's a catastrophe, it'll be back to the same, because at the end of the day, it's panic, which is interesting because it's interesting that it's been, compared to Europe, at least my sense is that the panic was much greater here. Would you say that's the case?
Oh yeah, definitely.
So, right.
I was going to say, the fifth thing I was going to say was we need to be able to look at the trade-offs for what we're doing. So if we're doing something for longer than 2 weeks, we need to say, wait a minute, is telling people to shut down their business for 6 months, is that a problem? We need to be able to consider that. But
what do you think of taking the decision out of the hands of public officials? What do you think about taking these decisions out of the hands of public health? Meaning, perhaps we should have a world, to Michelle's point about they're not going to learn their lessons because whatever reason, incompetence or need to be important or whatever it is that they may be well intentioned, but there are these vices that folks have that allow them to do this thing. What about taking those decision points away from them? Meaning, maybe we should live in a world where, a la Florida, where the governor comes out and says, no, the state, we are going to say that no one has the right to mask your child in school other than you. You have that right.
So I feel like there's two different roles that government can take in this, and one is providing a safety net and providing protection and serving, and the other one is the more authoritarian this is what you need to do, right? So I feel like looking at different types of government and public health, that a society cannot get along without that fundamental part of we need some sort of government or public health to protect individuals who are in need, poor people who you need access to food and water and healthcare and basic human rights and the rights to everyone else. But then and so I guess me being a Scandinavian, right, that's the part of the government that I love, right, because it makes things more egalitarian. I mean, but just philosophically, the part that I don't like is that part of you need to do this, not because of, science or because it's good for you, but because that's what we believe or that's our politics. That's where I think it gets dangerous. Right. So I don't know, can we have one without the other?
It's very strange because on the one hand, you can think, well, in places where there's a more robust safety net, like in Europe, maybe that's the reason why there was less panic. Yeah. But then you look at New Zealand and Australia, they have robust safety nets. And it was, I mean, we should consider lucky.
Right? I don't know, that played a major role into their,
Yeah, I suppose.
I mean, and once you start having those draconian policies, they become normal, right? It was so weird how something like closing schools, no one thought it could be possible or done. And everyone was wow, I mean, and I agree. I thought it was the right thing in the beginning too. And then all of a sudden it was fall and it was oh, but it's fine. We did it last year. Suddenly it's normal. And I wonder if that's what happened in New Zealand and Australia, as people were just well.
In the US, I think it's a lot of privilege, a tremendous amount of privilege, right? I think the suburban demographic that sits in nice tree-lined homes and lives in $500,000 houses and both parents are highly educated. I think that group can tolerate children being home and doing their thing, and at the end of the day, whatever their children do in school, they're still going to end up because of connections with
I mean,
whatever, right? And I think that, you know, in that's I think that has a lot to do with it. I think there's this idea there, because they can get away with it, because they can keep going to work because there's a nanny, right?
Right.
And I really think that they're the ones who are controlling everything right now, and that.
Oh, yeah.
And
They're
that,
the
and
ones
that's,
in control. And then,
yeah.
you know, I mean, not to pick on Sanjay Gupta, but I remember him saying like, well, you know, I just hired a tutor to teach my
Yeah.
kids at home, and like, you know, we're all good. And I'm
Yeah.
like, but I don't understand. Like, how many people do you think have the money to hire a tutor to teach
Yeah.
their kids? And like, I don't know. I mean, I know that he meant it in the right way, and that, you know, they were fine, and he, you know,
Yeah.
trying to protect people, but it's like, not everyone has a home like that.
Right. No, but that's the
And
sad
you're
part.
right.
But the sad part is that, you know, the Philadelphia school district budget is $3.2 billion a year. $3.2 billion a year for you know, for per student, that comes out to like $16,000 or $17,000 per student per year. And where did that money go during the, I mean, it certainly wasn't returned to anyone. So, you know, that's why you really, you know, yeah, I don't, you know, there are certain places like Norway and Sweden and stuff that somehow, you know, get it right. But man, I don't know. I think I'm pretty much soured on this idea that we should just rely on benevolent government officials to make the right decisions. You know, I
Well,
think.
who would you have make
Well, I think you know, I was always a huge fan of the public school system. I came here from India when I was 10 to this wonderful, really high octane school district in suburban Pittsburgh, Mount Lebanon High, Blue Devils, you know, go Blue Devils. And it was just such a fantastic school, massively resourced, beautiful library. Teachers were wonderful, took like every AP class I could. And it was fantastic. So I was a huge public school proponent, but the problem is that's not all public schools.
right.
And I think there's a number of, and then on top of that, even if you're in one of those good public schools, then you have the pandemic come along, and it can shut everything down. And maybe kids like me who have, like, you know, parents that are super educated and stuff, you know, maybe we can come through it okay. But I think for a lot of folks, you probably need to give, at least I'm pretty convinced at this point, that you need to give parents the ability to take that money that is going towards their kid, and that money should be able to walk to whatever school district they want, right? Right now you have like a captive audience, and the school district can do whatever they want, you know. And I think if you create a better marketplace where, you know, you have a huge marketplace of parents right now, right? Well, you may have 50% of kids, even in 50% of parents in California, even, that are like okay with staying home. But there's a massive, even if it's 30% of the kids of the parents of kids in California that aren't on board with whatever the schools are doing, right? That's a huge amount of dollars, right? The California school budgets are massive, that could walk to a school district that would do the right thing. And so I think taking away the ability for these public officials to mandate school closure, to mandate masks, to mandate all these things, and then allowing school districts to kind of do, you know, having more of a federal system of school districts that allow schools to do whatever they want to do, I think you will just attract, and those schools will be massively successful. You know, so you would have a school somewhere, I'm sure in all of California, you would have a school with a principal. Maybe you'd become principal, or you'd advise the principal rather, and they would follow you. They would follow what you said, and they would keep the schools open. But right now you can't do that through the public school system. You are stuck in your demographic. So I think
it depends on where you are, right? I mean, and I was a medical advisor for the Diocese of Northern California.
Diocese,
the
Catholic school. Look at that.
I'm not Catholic, but you know, I wanted my kids to be in school. So what can I say? So you know, and the school was open all year last year, so the kids went full time, and you know, no one died. There was not even any COVID that was caught in that our
right
school.
But Tracy, you were able to do that. You were able to take your kid out.
I was going to say that now in North Carolina, in North Dakota, where we're doing the mask study, there are two public school districts, right? Good. One has a mask mandate, the other has masks optional, right? So this is public schools, and they're deciding what they get to do. And it's interesting because, I mean, we've all along been following, as I think you know, and the rates are not different. If anything, they're a little lower in the mass optional school in terms of COVID. And the enrollment has been like shifting so that there's more kids in the mass optional school. So I don't know. I think it depends on the state what the rules are, right? Because in California, it's really strict.
No, yeah, right. No, well, that's what I'm saying. I think we should that should apply all across the United States. We should not, a kid should not be, if a kid is in a school that happens to have, say, a mask mandate or some silly thing where schools are virtual now, they go virtual at the drop of a hat. That kid and that parent should be able to should not be locked into that area just because they geographically live in a certain area. Like this public school system that you have in North Dakota that you're talking about, right? In order for a parent to go to a neighboring school, they'd have to move into that area most of the time. And I mean, no, I've done the same thing. My 5-year-old is in Catholic school for this very reason, because I want him to be in school and not be virtual at the drop of a hat.
So many people like us, physicians or whatever, we're just like, well, we'll just move our child, but not everyone can afford it.
We need to give, I think we need to give everyone that option and not just restrict it to us.
Part of it, I mean, I definitely agree with every child in school should have similar resources, though children with certain special needs should have more resources, and who's going to delegate that? Like, that's where it gets tricky. But like growing up in southeastern Wisconsin, I mean, it was terrible, the segregation and the, between how much money there was in the school districts in inner city Milwaukee and then in the suburbs. I mean, so I fully agree with you on that. Kids should have the access to the same amount of resources.
Right.
How we do it
is tough. Yes, exactly. All right, we're pulling her, Michelle, and we almost have her over here to the right where we sit.
I don't know. I need to pull you at the same time.
A lot of things I agree with. I mean, I don't know. I think people would have trouble pegging me down as to which party I would be part of, and I have trouble pegging myself down, but I think that's the way it should be. I don't know.
No, that is exactly what it should be. We should all be for the kids and what's best
both of you have too lofty an idea of what the educational system and whether we even need education.
Michelle is
I think
always.
Kids are wasting it. I mean, I think I think it's a silver lining that kids are not in school. I mean, they're just these factories of indoctrination that we send them to. I mean, that's the last thing where I want my kids to be.
Interesting. It's like things work.
I mean, think about it. I mean, the world that we live in is the product of the school system and the healthcare system. I mean, both of these things are atrocious. And so why do we want to fight, to preserve them or give more access to them? No, let it.
You know what the scary thing is? That Michelle is always proved right 5 years from now. I'm telling you, like 5 years ago, I'm like listening to Michelle talk. I'm like, this guy is like, that is so far out of out of the zoo. He's like the Alex Jones of cardiologists, and then like 5 years later it's like
Alex Jones is always right.
He's always right.
Well, I mean, I guess one could debate exactly about like how and where a child should get their education, but like providing basic protection, I think, to children is very important. And I think it's what separates first world countries from third world countries is like the ability for countries to provide access to education and healthcare and protection to children and the most vulnerable in their society. So, I mean, I think about it a lot, like where should that come from? Who should be responsible for it? But it is the responsibility at some level of a society, right? So
yeah,
you can tell us, Michelle, where
not sure. Okay. I mean, it's the responsibility of the families, the parents, the primary responsibility. Now they can delegate it, but they need to. I mean, in that sense, I mean, I agree with Anish. They need to have as much freedom as possible to delegate it. But we've created. I mean, this is a 100-year-old or 150-year-old ideal that we've set on ourselves. That this standard education and whatnot, but not all kids need, kids could learn, they need to work. I think kids should work at 14, right? Some kids will be much happier working than getting a high school diploma that is worthless, right? So we're wasting a lot of time and a lot of kids' times learning stuff that they don't really need to learn, and learning it badly when they could learn it much better. I mean, there are certain ways that they can learn to read and write and compute much better in a way that is completely, I mean, that is very different from the way we conceive of it right now. When you think about it as, oh, society has to provide it. Well, if you say society has to provide it, then it's going to be a standardized, awfulness of an education system.
Well,
I think we should let people, families should be free. Now, of course, families, I mean, there's a double standard. A lot of families don't want to take that responsibility and would rather delegate it to society and to the state. Right? There's an appeal to that, but that's wrong for the kids.
Yeah, I mean, I guess I worry because for so many kids, it's like school is it's at least right now, it's their access point to socialization and to sports, and to safety and
right.
to lunch, and so it would need to be somewhere else. Because like when school ended for my kids, I mean, it was devastating for them, and they sat on the couch and did Zoom, and I took them to the park and went running, and like, but my husband and I were still working, so we can't be there for them every day. They're little kids, like, and even daycares were closed, so it was like, wow, this is terrible, right? I mean that it was. Yeah.
You're right when you're right, but it's so in that case it's a symptom. I mean, it's a sad reflection on society when you need these standardized schools for kids to have an access to socialization. Right. I mean, kids should be socialized naturally, right? And I mean, we should have healthy societies where kids are socialized naturally from just growing up in the society, and not have to just have, okay, we have the professional socializer that's going to be the school, and right, and they're gonna, we have these trained socializers that are going to teach our kids how to socialize, and it's a disaster. But that's, I mean, obviously.
I mean, I think, well, it's something we're not totally philosophically aligned on because of, I guess, a lot because of my experience in Europe and in Denmark, sort of seeing how different school is there, actually, that kids are in school for a shorter amount of time, but they're outdoors a lot, and like there's a lot of focus on socialization and art and activity, and like things that you learn by being together with other people, and that are essential parts of growing up. And
I mean I don't dispute that. That kids should do art and socialize, but do they need a government structured system for providing that? I don't know. I mean, I'm sure the Danish system is better, but I don't know that it's ideal either. I don't know that it's the best that it could be for kids, but it's really, I mean, it's
equal. And I like that. I mean, I don't know, maybe I'm an idealist, right? I guess. But
right.
Michelle, you'll have to spend some time with Dr. Høeg here.
Yeah.
We will.
We can talk about this for a long time.
A few more podcasts. You'll be singing your tune, just like me.
Or wait 5 more years. Yeah.
Well, Dr. Høeg, it's been so fantastic having you. Thanks for coming on. And really, I mean, I meant what I said earlier. You are like have done a fantastically impactful job in kind of getting the message out there. And you come at it from someone that's incredibly concerned about kids, the effect of these policies on kids, and unlike many of us who just have an intuitive feel for it and talk about it, you've done a lot of really, really hard work in terms of putting out data, publishing it, preprints, etc., and preprints, non-preprints, CDC, MMWR. So kudos to you for shifting the needle, and I think history will look back and you will be one of the folks, one of the good guys that got kids back in school. So thank you.
That really means a lot. Thank you. I'm so happy to have found your show, and you guys, I think, give support to more people than because many of us go around thinking we must be crazy, but like you have had on phenomenal guests, and I've really enjoyed it. So thank you so much for putting all the work into it, and it's a wonderful show. Thank you.
Thank you, Tracy.
Thanks so much. Michelle does